Hello, and welcome to the BLED podcast, Birth, Love, Experience, and Death. I'm your host, Stephanie Bushak.
And I'm your co-host, Matthew Bushak.
Yes. And
Or Matt.
No matter how hard we try, we just can't get that camera just where we want it.
Yeah.
So what are we talking about today, Matthew?
I don't know, Steph. What are we talking about?
Today we're going to talk about surgeries.
Okay.
Yeah. You know why this subject came up?
Because we have a lot of surgeries going on?
Yeah, we do. Matt just had his surgery,
Mm-hmm.
and I have one coming up.
I had 2 surgeries.
Yes. Yes, you did. That were how far apart? They weren't that far apart.
6 months?
Yep.
6
So,
months.
apparently, as you get older, they need to like sew you up more.
Yeah. And I can already feel it in my shoulder when I'm working out. There's something going on there.
Oh, yeah.
I'm going to ignore it until it gets so bad that they have to cut my bone again and drill some screws in.
Yeah. Okay. So, like, what's the first surgery that you can think of that you ever had?
My first surgery was my shoulder. My left shoulder, I dislocated as a senior in high school the first time.
I remember that.
I
remember talking to you later and you being like, I threw it out in volleyball and my dad had to come and get me from school and take me to the hospital.
And, we had to figure a way to do our library stuff with my sling.
For those that are listening, library was put in quotes.
Yes. And so, I went to, they still let me go to boot camp. They thought I had some kind of collarbone separation or something. They didn't really check it that well. And so I went to boot camp, I was fine, but then in the Marines, I dislocated it a couple times. They just gave me Motrin, told me to take it easy. So finally, and then in college, I dislocated it probably
a few times. Yeah. I can remember you like sleeping on it weird.
Yeah. I mean, I was just sleeping on my back one day and it's like, it came out and I'm like yelling at Stephanie to get up because I can't put it back in.
Yeah. That was fun.
And this wasn't the type where like, Mel Gibson in
like Lethal Weapon or whatever. Yeah, he just smacks his arm and
he dislocates his arm. He swims down. He gets out of the chains. He comes back. He beats up the bad guy, and then he just knocks it back in place. No, this is bullshit, dude. When that thing would go out, there's a bundle of nerves in there that it would just compress, and it hurt like a motherfucker.
Yes.
And so finally, you good with the camera now?
I am.
She'll probably adjust that 4 or 5 more times, so just don't pay attention.
I'm a little OCD, y'all. I like things to be kind of thinnered.
And so, so finally, I got out of the workforce, the real workforce, and I had health insurance. And so the last time I dislocated my shoulder in college, I had to go to the hospital to get them put back in. And the last time, and then I dislocated it once I started working a real job back in, 2000, no. Yeah, 2001. So 2001, I had a bank heart lesion repair. So basically, your shoulder joint is like this, and there's a labrum or a kind of a mass that's around it's like a saucer with like a fleshy lining around it.
Okay.
And so what happened was I broke a hole in that, and so that's where. So it didn't matter what I did to strengthen my muscles. That had to be in there and repaired. So they went in. I don't know if I still got a scar. I got a little bit of a scar.
Yeah, got a little dip right there.
And so they went in and they raw. And they cut me open. I remember being home from recovery when 9/11 happened, and I was on drugs, and I was just watching it like, what the? Is this real? Is this like a TV show or something? Like it was. Bizarre. So that recovery was a long time because it took a long time to get my shoulder, all that scar tissue broken up where I can put it above my head again. So
a lot of PT went into that.
Yeah, but it's been really good. It's held up. I remember in physical therapy, one story where I'm on my back and he's stretching my arm as far back, as it can go. And I had my eyes closed. And I'm like, oh, I bet I can feel the pillow behind me. And I opened my eyes and my arm was like right here. I was like, oh shit, I got a ways to go, you know? But it's been solid ever since, never dislocated again. Never really gave me troubles. I'm getting a little trouble here, but I don't know if it's that or maybe something else,
Yeah.
rotator cuff or something.
Yeah.
But,
I wouldn't be surprised if you had some pretty good arthritis starting to go in that arm.
got arthritis everywhere.
Usually, well, you do. Usually, as you get older, you start getting arthritis everywhere, but it really attacks the places that have been previously injured.
Yeah, like my ankles.
Yes, yes.
So that was 2001, my first surgery.
I remember when you dislocated your arm in college and you had to go to the hospital.
Yeah.
And you described him as an old as dirt doctor.
I dislocated. Usually when I dislocated it, I could get it back in. I didn't slam it against anything.
Yeah,
I let it loosen up.
He could loosen up and have it go back in. Or there were a couple of times where he asked me just to pull down real gently on his arm, and it helped to go back in.
But it did get to a point where it wasn't going back in, and so one time I went to the, A&M had a clinic there that you could go to, a free clinic, and so I went in there, and this guy was old as dirt, and they tried to give me some Valium to just relax everything.
Yeah.
And they couldn't find the vein. They put it into my muscle, which burned like a motherfucker. And then dude comes out and he's trying to manipulate my arm. You know, he can't do it. So finally he takes his shoe off and he sticks it into my armpit and he starts yanking and I'm screaming. And he finally got the damn thing back in. But I'm like, yeah, don't go to your campus.
Don't go to the student clinic on campus.
Yes, that was a mistake. So yeah, it was. That was a very painful thing to have. That's probably the most pain I experienced in my life. Is probably dislocating my shoulder.
Yeah, I imagine that was pretty horrendous. Yeah.
So that was my first one, and then you had one. Actually, yours was before that. Your gallbladder.
My very first surgery ever was on my skull.
Oh yeah.
Yeah. I was in a car accident when I was 2 and my mom was driving and apparently the person that another car hit our car and the person that hit our car was in a cast on the right leg and was trying to drive with their cast on. And so my mom said, the story is, my mom said I conked heads with her and it cracked my skull. And so, of course, ambulance came and took me in and I had to have surgery. I had to have skull fragments taken out because apparently it had kind of caved in and skull fragments went in my brain. That explains a lot, I know.
Yeah, it does.
Yeah. And so, yeah, that was my first surgery. And even now at almost 53, if I've had a scan done on like an MRI scan done on my head, and you can still very clearly see where the scar is. Yeah. So
I wonder if they ever do like an MRI on your eye.
I don't know.
That'd be an eye MRI.
An eye MRI.
You're welcome.
But I feel that's obligatory for me. I have to do when you start going, thank you, or you're welcome.
Crash or whatever.
Yes. But my mom told me, and I don't know how true this is because my mom tended to exaggerate a lot. God rest her soul. And I love her to bits, but sometimes she would exaggerate on stuff. And I remember her telling me that it was the first female brain surgeon in the state of Texas that worked on my skull surgery.
That explains a lot too.
Hey,
anyways,
that doesn't get a bump, okay?
So the next,
I'm about to cancel you, bro. Watch it.
Oh, shit.
Damn.
Well, it's gonna be this Steph Bushak podcast. Sorry, guys. I've crossed the line, I guess.
Yeah.
Well, then you had another one before I had my shoulder, so your gallbladder, I think.
Yeah. Yeah, was that, I guess it was before your shoulder?
Have kids yet.
Okay.
And we had kids.
Yeah, I had my gallbladder removed. I was like 24 at the time, I think. 23, something like that.
No, because we lived in Washington.
Yeah, so 24. Does that sound right?
Sure.
Okay. It was before I had kids. How long were we there before I had kids?
So it was probably in 98. So
Okay.
you're probably 26,
Okay.
25, 26.
Okay. And I know my grandmother had had gallbladder surgery, and when she had it done, they did like this big, huge incision, and um, she was on recovery for like weeks afterwards. And when they did mine, which was only actually it was like maybe 8 years after she had hers, they had microsurgery. And I only had to have 3 teeny tiny incisions done. And it only took me like maybe a week at the most. And that's talking like getting back into full doing everything. So it was way different. But come to find out, gallstones and kidney stones are hereditary.
Yeah.
Yeah. And I've done some genetic testing, and I carry that gene. Sonny had both gallstones and had to get his gallbladder removed, and he had kidney stones. I've never had kidney stones before.
Yeah.
So,
Well,
but
then,
yeah. And I remember having that surgery, and you were really nice. You set up a pallet for, like, you set it up to where I could watch TV out in the living room.
I moved the entire bed out of the living room. Yep.
Yeah. And which was really sweet. And then
it probably would have been easier just to move the TV.
Probably so. I don't know. I don't know if our room was configured to where we could put a TV in there.
Yeah.
But I remember you trying your damnedest to make me laugh, which you've always done. But me like laughing and hurting a lot those first couple of days. Like, I usually don't say, don't make me laugh, but
I probably wasn't trying my damnedest to make you laugh.
Yeah.
I was probably just being normal. But funny.
Because you're hilarious.
I mean,
yes.
Yeah, people laugh. I wasn't I wasn't trying to torture you by making you laugh.
Yeah, you were.
No. Stop that. All that is going to be in this. So.
Yeah.
Sorry, folks.
Yeah. You having a day?
Yeah, sore throat.
Yeah, he was telling me the other night he was starting to get a sore throat.
So the next surgery was my surgery.
Yeah, so your shoulder surgery.
I had the shoulder surgery, and then before that I had another surgery.
Did you have your first back surgery?
I had my vasectomy.
Oh yeah.
Yeah, that's kind of funny. So
yeah. No, your vasectomy was after. Oh yeah, before your shoulder surgery. Yeah,
because it was my vasectomy was the October after the kids were born.
Yeah. We went. Okay. Oh, they come in twos.
2 months.
What can we do about this so it doesn't ever happen again?
And so I went to get fixed because it's so funny that we call. Well, I'll say this for another podcast. Anyways, so I went to get treated so I would not impregnate my wife anymore.
Yes.
And we weren't going to practice celibacy.
No.
Because I couldn't keep her off me.
He was kind enough to realize that a hysterectomy was not a kind solution.
Oh, it's easier for a guy for sure. And so I went in there, and so this is kind of funny because, like, the doctor asked me, would I be nervous? And I'm like, oh, hell yeah. And he goes, okay, I'll give you a little something. So he gave me a prescription for 2 Xanax. I had never taken Xanax before, never taken it. And so I took one before. He said, take one before you get here, and we'll give you the other one when you get here.
Yeah.
Well, I took the one. I didn't need the second one. And so what they do is they shave you. Which I was shaved by this dude with a Ron Jeremy mustache. I mean, like
brown chicken, brown cow.
I was like, this isn't going to turn into some kind of porn or something, is it? Like
only if you let it.
That dude, that dude down there, touching my dangly bits, and I don't know. But no. So they did that. Then they give you a local anesthetic, which doesn't really hurt. I don't remember it hurting.
Did they give you a shot in your balls, I guess?
Not in my balls, but
where did they give it?
I think like in the part that's underneath it.
Oh, the perium or whatever.
Y'all look it up.
Mm-hmm.
We're not gonna be able to tell you.
The taint?
Something like that, yeah. I think.
Okay.
So what they do is they take a crochet needle, and the doctor's telling me this, like crochet hook, and they poke it into the nut sack, and then they grab the
Vas deferens.
deferens and pull it up.
Mm-hmm.
They cut it, they tie it, and then they burn it, both ends, and then they put it back. And so he did one, and so I'm talking to the doctor because I'm on Xanax, and I'm like out of my fucking mind.
Yeah.
I'm like, so what does it look like? He goes, oh, it kind of looks like a spaghetti noodle. You want to see it? I'm like, sure. So he pulls it up, and I look down, and sure enough, it looks like a damn spaghetti noodle. And I just fell.
So, oh, yeah, it's okay.
So-
I'm sure it's okay.
So I'll fix it in a second. But anyways, so yeah, so it looks like a spaghetti string.
Yeah.
Yep. And he cut it, he did everything, he put it back, and as far as we know, I'm still sterile.
Yeah, I've never seen anything from my outsides being or my insides being shown to me on the outside like that.
Mm-hmm.
So that would be a little freaky.
Sorry if this is making extra noise.
It's okay. Matt's getting his shit together as usual. It's an ongoing thing.
Can you hear me?
So yeah, I was super grateful that you did that.
Yeah, that me too, because
Makes things a lot easier.
I didn't have to pull out and do the money shot anymore.
Yeah.
Like that was everything.
Yeah.
But so that was my surgery in 1999, and then I had the shoulder surgery in 2001.
And then you had a back surgery.
And then in 2003, we moved to Texas.
Wow. You were under the knife an awful lot back then.
Mm-hmm. And it was actually 2004 that I had the surgery. And so I had this back pain radiating down my leg. And it hurt so bad, I had to crawl to the bathroom. I mean, I couldn't walk. I couldn't stand up.
I remember.
And it was horrible. And so went to the doctor and the surgeon, and I had a lower lumbar laminectomy where there's two things. I had a ruptured disc,
Mm-hmm.
and a disc is like a jelly donut.
Mm-hmm.
And so when it ruptures, the little jelly comes out the side, and that hits your nerve.
Yeah.
So they took that piece out and cauterized that.
Mm-hmm.
And then I had a bulging disc where they cut the bulge and cauterized it to get it away from the nerve. So that was in 2004. Recovery from that wasn't too bad.
Yeah, from what I remember, your scar wasn't super big on that one.
No, yeah, it was probably just
your scar was actually a little bigger on the last one you had.
Oh, it was, yeah.
That freaked me out how much bigger it was.
You had to move more muscle out of the way, as you said, but we'll get to that. But yeah, that one has been, I mean, my back's always been sore. It never really 100% recovered, but it
is what it is.
I've been able to play basketball and do all that stuff.
Yeah, enough to survive without having to crawl to the bathroom. What's the next surgery somebody had? I don't know. I don't think I'd had a lot of surgery.
I didn't have another one until recently. So you had your breast reduction.
Yeah, that's true. Yeah, I had a breast reduction, and I wanted to go ahead and do a tummy tuck while I was in it, but the recovery for the tummy tuck was so long and arduous that I was like, I don't think I can physically get away with going that long without lifting stuff and moving around and stuff. So, but I did the breast reduction. It was really cool because insurance covered it, and it was one of the best surgeries I've ever had. I was so glad that I got it done. I'm still so glad that I got it done.
Yeah.
Yeah. It just took I don't have the divots in my shoulders that I used to have, and I don't have as much as upper back pain. It's easier to keep posture when I'm
And they look
conscious
real
of
nice,
it.
just saying.
They look good. They point up instead of pointing down. I developed early and had lots and lots, and
then you had twins.
And then I had twins, and I still had lots, but they were down low.
Yeah.
And I was like, oh, it's bad enough having lots and lots. It's even more so when it's when you have to pay $70 for a bra, and you want more than one bra.
You're rubbing your thing there.
Oh, okay. Sorry. And you want more than one bra. And so, it was, now I can pretty much buy bras off the shelf. I happen to be a little particular, but I don't have to go to like a specialty shop or anything like that. So that was pretty cool.
So that worked out well.
Yes, it did.
Did you have any other surgeries?
I did have lipo, I think, at the same time on
Yeah.
my stomach as I did my breasts.
Just right around the same time.
Yeah. And then let's see. Sunny had surgery.
So, well, there was one surgery that you had, and we needed to leave the house for a minute, and you're like, "That's fine." And then you stood up and you fell down and busted your nose or something.
Yeah. What did I have done?
I don't know what that was. That may have been one of your lipo sessions or something.
Yeah.
You also had your nasal cavity drilled.
Oh God. That is the worst surgery I've ever had. And the reason it was the worst surgery I ever had is because, first of all, I wasn't 100% knocked out for it. But when they do this surgery, they literally take like a knife or like a chisel and a hammer, and they break up your septum. And you can I wasn't completely knocked out, and I don't know if that was protocol, if most people are completely knocked out. My eyes were taped shut and I couldn't feel anything, but I could hear almost everything that was going on. And I think they just didn't like give me enough drug or something. And I remember talking during the procedure being like, I don't like this. And I remember crying and being like, I don't like this. I can hear everything, and I can't feel like I can't breathe and all this other stuff. And so, they were just kind of like, oh, you're okay. We're blah, 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 just trying to talk me through it. But after surgery, when I was sitting in the recovery room, I was freezing my ass off. I felt like I couldn't breathe very well, and I wanted to throw up. And I was telling the nurse this, and that was in there with me, and she was literally just sitting there fucking around on her phone.
Ignored her, yeah.
Completely ignoring me. And she was like, you'll be fine. Just breathe. Just breathe. And I'm like, that's what I'm telling you. I feel like I can't breathe. And I was shivering like so hard. I had a sweater.
I had to come in there and like take care of her.
Yeah, I had a sweater that was probably about 7 feet away from me in the recovery room, sitting on a counter. But I couldn't get up because I was like, everything's swimming, And so I looked at her and I go, could you please hand me my sweater? Because I'm freezing. And she was like, yeah, hold on a minute. I mean, I've never had a medical experience. Like, I don't know if she was on her last day and get ready to walk out the door or what the deal was. But so she doesn't bother to hand me my sweater. And then at one point I tell her I'm going to throw up, and she starts going, no, you're not. No, you're not. Like, that's going to stop it.
Yeah.
No, that's not going to stop it. So sure enough, at one point I lean over and I start throwing up, and she runs, to get the trash and throw it under me. And she's like, you need to stop doing this. This isn't good for your recovery. And I'm just like, oh my gosh, I cannot believe the shit this lady's telling me. But as I'm throwing up, I just start peeing all over myself. I completely lose control of my bladder. And so they finally let Matt in. And here I am sitting like literally in a puddle of my own urine. I just vomited. I'm freezing my ass off. And Matt runs over to me and he's like, oh, baby, are you okay? And he's like, I'm like, I want my sweater. And he's like, okay. And he grabs my sweater right away and puts it on me. And he's like, oh my gosh, did you pee on yourself? What is that? And I'm like, yes, I just threw up. And
it was pretty bad.
I usually, almost all my doctors that I've had that I've seen a few times, I go and write a review. I've probably written like 6 glowing doctor's reviews over the years. That one was the only negative review I ever gave, and they totally deserved it. I could not believe how horrible my experience was.
Yeah, that's bad.
It was traumatizing. Yes. I actually, like, literally immediately afterwards got depression again, which I hadn't had in probably like 3 years. And I started it like up my anxiety. I started having random anxiety attacks after that. So,
Crazy.
yeah.
So the next surgery was well, we don't have a whole lot of time. Ryan prolapsed, had to have surgery.
Yeah, that was scary.
That was scary. Yeah. If you want to look up rectal prolapse, you can look it up.
It was horrible.
It's bad. It was, yeah, it was sticking out like 12 inches.
It was literally the day before he was supposed to be scheduled
right.
for surgery. And he's in the bathroom and I can hear him crying. Ryan doesn't cry. And so I ran into the bathroom and there's like blood all over his hands. There's blood on his side. He's sitting on the toilet. And so I put my hand on his back and I make him lean forward so I can see what's going on in the bowl. And he had a prolapse that was the size of like a cantaloupe.
Yeah.
And so I freaked out and I grabbed the hand towel that was in the bathroom and I put it underneath him and I was trying to help him push it back in. And I was like, there's no way. There's no way. I mean, the spot it needed to go in was still way too small for what was sticking
Well,
out.
even the doctor couldn't push
Oh,
it back
yeah.
in when we
And
got
so
to the
I called
hospital.
Matt. The ambulance came. The ambulance said they had never seen anything
Yeah.
like that.
I mean, they were still calm and
Yeah, they did a good job. But Matt asked him, so have you ever seen somebody have a prolapse like this? And they were like, no, that's pretty bad. And then he was,
it was during COVID too.
yeah, and his prolapse was out for like an hour or hour and a half.
Maybe more than that. Yeah, it was a long time.
Yeah, before the surgeon made it up to the hospital.
Very traumatic.
And they did emergency surgery on him. It took like 8 people to try to give him a sedative, and the sedative did not work.
Oh gosh, yeah, we were holding him down, and
Matt and I cried our eyes out because it was the scariest thing we'd ever seen him go through.
It was very scary, and yeah, he was in the hospital I think for 2 days after that. But the cool thing is he never had any issues since. Like I was afraid, the surgery he was going to pull out the stitches or something or do something, but
no, he healed really nice.
He healed really nice.
The only thing he has now is every once in a while he'll stem on pushing, and sometimes he'll get a little bit of blood that comes out, but it's not. There's no prolapse. Yeah,
probably more like hemorrhoid stuff.
Probably so.
There you go. There's Never thought we'd say hemorrhoids on this podcast, but
no, we're gonna say everything we can think of on this podcast. You want real? We're gonna give you real.
100%.
Yep, that's right.
And then, so the next thing I can think of is, well, Sonny had a double mastectomy.
Yeah.
Which worked out real good.
Yeah. I think he was he 17 at the time? 18?
Probably, yeah.
Somewhere around 17 or 18.
So he had a real good experience with that. Didn't scar up too much.
No, he was so happy he got it done too.
He was very excited.
Yeah.
And then recently I had numbness in my thigh, and so I went to the doctor and they did an MRI, and so they did a discectomy on my back on a different area, which was supposed to again make space between the nerve and the disc, and it didn't quite work because I still have numbness on my thigh.
Yeah.
But I also thought that had something to do with my foot. So when the back surgery happened, my foot, and by the way, I had that back surgery the same day that Sonny passed away. We talked about that last episode, but just weird to think about. But that was a longer scar because he had to move more muscle out of the way. He had to get in there a little further. So then I went and had an MRI on my foot and found out that I had ruptured a tendon that goes underneath my foot. And what they had to do was they had to do calcaneus osteectomy, which means
I'm impressed.
They take your heel, imagine your foot and your heel. They cut the end of it, clean off. They moved it over about a centimeter, and then they put 3 2-inch screws in to hold
Big
it
old
in.
huge
Big old
screws.
huge screws.
We got the x-rays afterwards, after they did the
And
surgery, they
so
did an x-ray, and it was like, holy crap.
so I had that surgery. So I had the December 20th, 24, and then 7/16/25 was when I had my ankle surgery, my foot surgery.
Yeah.
And that was pretty intense. I couldn't put any weight on my foot for 8 weeks. So I was in a splint and a cast.
Yeah, the recovery for this
I
last surgery has been the most arduous recovery any of us have had on a surgery.
It was my right foot, so I had to cast on my right foot. And speaking of driving, so I wanted to drive because not being able to drive is like the worst fucking thing.
Yes.
Trust me.
Matt loves to drive.
I mean, for anybody, if you were stuck and you couldn't drive anywhere.
Oh yeah, I'm sure after
anybody.
my surgery, I'm going to have some moments.
It just sucks not to have that freedom when you're used to it. And so I got this device where I could use my left foot to do the brake and the gas.
Mm-hmm.
And I was doing okay until I was in the parking lot and I panicked and I mashed the gas and I backed through the cart return, hit a full-size Chevy truck and pushed that into a small Honda.
Mm-hmm.
That's how hard I'm lucky I didn't kill anybody. Very, very lucky. And so after that, I got rid of that device.
Yeah. Yeah.
It's like, maybe I shouldn't have been doing that. But then I got a little hand device that worked great.
Yeah, I think I was telling Matt when he switched out devices, I think it's going to be easier to train your hand to do something new than to try to retrain your feet to do something opposite of what you've been doing all along. and he ended up adjusting really well to the hand mechanism, but you don't know until you try it.
So that's all my surgeries.
Yeah.
I mean, I've sprained ankles, I've dislocated fingers, but
yeah, I can't think of any others that I've had. I have one that's coming up. That's what prompted the whole surgeries podcast is I'm like, gosh, how many surgeries have all of us had so far? And so yeah, I've got a surgery coming up in about another like 2 weeks. Is it 2 weeks? I think it's 2 weeks. And I'm going to have the laminectomy like you had. And then they're going to like completely scrape everything out. And they're going to put a device in there that promotes bone growth to have bone grow in there. And it'll make two of the vertebra permanently attached to each other, and then they reinforce it with a couple of brackets with 2 screws in each bracket, which is a fusion. So I'm having a laminectomy and a spinal fusion in one go, and then I get to spend one night in the hospital, hopefully only one night. But the bonus is that my recovery is not going to be nearly as difficult as your recovery.
Yeah.
I think the biggest restriction I'm going to have is like no bending, twisting, or lifting more than like 10 pounds for several weeks. But my PT that the doctor recommended to me, he's like, just get up and walk every once in a while. Don't sit for too long. Get up, walk around the house, do your normal walking around the house stuff that you do. And I said, well, that's perfect. Because honestly, I can't stand for too long. I don't like sitting for too long, and I don't like walking for too long. So I rotate between the 3 all the time. So, yeah.
Perfect.
So, hey, Matt, guess what?
What, Steph?
Life will kill you.
I know that.
Yeah. Oh, before we go, we're going to do one more episode for the season next week. And then we're going to take a little break. We're going to take a little vacay away from the podcast. So yeah, if you clicked on one of our videos, I know a lot of people watched our last sunny video. We'd appreciate it if you could subscribe through whatever service you're listening to or watching us from. If you could like our videos or our podcast, we'd appreciate it. And if you have any surgeries that you've had done that you want to talk about, go ahead and leave a comment and let us know about it. And if there is a subject you would like the Bushaks to talk about, let us know that too. So, anyways, we love you guys and take care of each other, kids.
Bye bye.
Bye.